Well, good morning, everyone, and welcome to the Coalition of Orange County Community Health Centers Coffee Connections event. It's wonderful to have you all here today. My name is Isabel Becerra. I'm the President and CEO of the Coalition of Orange County Community Health Centers. I'm honored to welcome you today to today's Coffee Connection event, Finding Common Ground, a conversation on vaccines, public trust, and differing perspectives. As this is our final Coffee Connections event of 2025, I also want to take a moment to acknowledge what a year it's been. With so many changes at the federal, state, and local level, having this community come together for honest dialogue has been really meaningful for the work that we do, for us as a team, for us as a community. So I really thank you all for being here today. And for anyone joining us for the first time, the Coalition of Orange County Community Health Centers, we are a membership organization. We represent the interests of community health centers in Orange County because we serve the county's most vulnerable communities and populations. We represent 20 community health centers, one community-based organization, and collectively, they operate over 90 locations across the county, serve about 240,000 unduplicated individuals to the tune of about 1 million visits a year. So we are a force to be reckoned with in terms of advocating for the needs of our communities. I used to call ourselves a little mini Kaiser. People didn't like that very much, but I just want to stress the fact that united and together, we're able to, again, gain a lot of ground on all of the issues that are critical and important to our communities. So I'd like to start by taking a moment to thank, again, those of you that made today possible. All of our attendees, we're a small but mighty group, so thank you so much for being here today. It might not be as an exciting topic as the politics that we're dealing with in our environment, but it's still a very important topic for us to address, again, with the experts that we have on our panel today. So thank you for showing up. Thank you for your commitment to equity and for engaging in this important conversation. Again, thanks to our speakers for lending your expertise, your time, your compassion, and again, commitment to the work that we do. And then to our community health centers and partners, your dedication to the community work that we do is at the heart of our mission. So again, thank you for those that are returning participants of our Coffee Connections events, and for anyone that's new here, welcome, and please tell all your friends. This morning's discussion, I think, is very timely. Again, is there common ground? A conversation on vaccines, public trust, and differing perspectives comes at a critical moment. You'll hear more why in a second. But the COVID-19 pandemic didn't just reshape how people think about vaccines, as you all may recall. It reshaped how people think about science, institutions, and each other. It exposed longstanding fractures in the trust and created new ones, leaving many individuals and families navigating a landscape filled with conflicting information, ever-changing recommendations with heightened uncertainty. Across federal, state, and local systems, we've seen rapid shifts in public health guidance, political polarization, and profound differences in how communities interpret risk, safety, and responsibility. And while these conversations play out nationally, they land most directly in our exam rooms, our waiting areas, and our neighborhoods. For health centers and community-based partners, the challenge isn't simply providing information. It's rebuilding trust, understanding the experiences that shape people's decisions, and recognizing that people can arrive at very different conclusions as they consider all factors for themselves, their families, and communities. So this is why today's dialogue is so important. The session is designed to create a space where we can listen, not to debate what is right or what is wrong, but to understand the diverse factors shaping views on vaccines and public health. We want to hear from speakers who bring differing perspectives, lived experiences, and roles in the broader continuum of care. Together today, we will explore what shapes vaccine confidence or hesitancy, how personal experiences, community narratives, and information sources influence trust, how communities are responding to differing recommendations on vaccines. And again, we have hot off the press new information today. How they respond to different recommendations and treatments, and which voices people turn to when making decisions about their health. And we think we brought the critical voices that people listen to when making decisions about their health. And our goal today is not to resolve any difference in one conversation. We know better than that. Instead, we hope to identify opportunities for finding shared values, uncovering places where common ground exists, and lifting up actionable strategies to strengthen trust, communication, and understanding across communities. At its heart, this conversation is about exploring different perspectives, recognizing that ultimately we all share the same goal: healthy individuals and healthy communities. What differs is how we go about achieving it. By listening, by reflecting, and engaging with one another today, we have the opportunity to deepen that understanding, uncover common ground, and consider new ways of approaching these challenges. So, with that all in mind, let's dive into our conversation and hear from our speakers as we explore the perspectives and experiences and insights that will help us find the common ground that we're looking for. So, to start, I'd like to give our speakers a moment to introduce themselves, and we're going to go in order this way. So, share a little bit about your background, your role, and the lens that you bring to this conversation. So, we'll start with you, Jackie.
Hi, good morning, everybody. My name is Jacqueline Hernandez, and I am a health educator. I currently work at LA County, but I do come here as my own self. I do not represent views from LA County at this moment. And I've been working at LA County since the pandemic, but I had experience working in health policy for 10 years already. So I've had a lot of experience with community health, and I bring a lot to this conversation through my experience with Plain Language that I manage, the Public Health Ambassadors program that I also manage in LA County. And I'm here to talk a little bit about how that plays into the role of how we communicate with the public.
Nice to meet you. My name is Hilan Shapiro. I'm a practicing pediatric community member. Also, I work in OC in LA County. I work in Altamira, one of the largest federal qualified health centers that we have been doing that partnership for years. And part of my role is coming here as a pediatrician, but most importantly, as a father. We have right now the opportunity to bridge the gap of information, and we are all here not as influencers, and that actually includes each of you. We are here as experts. We actually know what's happening on the community, the questions that we are having, and most importantly, sadly, we do not know how to treat that. Then all of us have been advised, treated, educated to actually have and save lives. But sometimes when we're in front of our patient, that training doesn't translate on what's actually the real question that our communities are having. And I love that this is a very timely panel, and a pleasure to be here.
Thank you.
Hi, my name is Regina Chincio Kwong, or Dr. CK. I'm a board certified family physician, and I'm currently the county health officer. But prior to being a county health officer, I was a family physician out in the community. And even prior to that, I was a military physician. So I come also with a different perspective in that I also sought into integrative medicine from the early get-go, even in my medical training. So I'm actually an osteopathic family physician, so I already sought to do things differently. I learned acupuncture in the military. I tried to care for my patients in a 360 holistic fashion. And what I bring to the table is a different perspective from my experience. When I was a family physician out in the community and seeking different opportunities for my patients, what I heard was a lot of the patients had fear and really wanted to have that connection and be heard. And many times in our short visits, we don't have that time to sit and listen for them to then gain that trust in our care. And I think maybe I can provide a little bit more about that later in the discussion, but I think we need to repair that relationship so that our community, our patients feel they can trust our care and our scientific perspective.
Hi, good morning. My name is Natalie DePorto. I am the lead school nurse and director of health services at Brea Olinda Unified School District. I'm also the chair of the Orange County School Nurse Organization. So, and I have a background in pediatric critical care. And I am bringing the school lens to this panel, as I am often collaborators with the community healthcare providers and pediatricians, and I see the gamut of where vaccine hesitancy, or they get the vaccine, or they're afraid, or they don't trust, or I see the whole gamut of that in the schools. And so I've learned some tools and skills in listening and trying to really pinpoint, why this guardian or parents don't, are hesitant to get the vaccine. And I think it's super important to listen to them and luckily for me, I'm not seeing them for a visit. And I'm usually called in to the cases where the family hasn't turned in their vaccines. And so they refer it to me. And so I come into the situation pretty much ready to listen and really hear what's going on. So I bring that to the table today. Thank you.
Good morning. My name is Chris Zimmerman. I'm Deputy Medical Director for Communicable Disease Control for Orange County Public Health. I'm trained as both internal medicine and pediatrician. I've worked in primary care and was a medical director of a federally qualified health center, but I've also worked in public health, both here and globally. I worked on polio eradication in Africa and Southeast Asia. So I think I come from both a care provider, but also a bigger scope of public health perspective.
And my name is John Bilomek. I'm a PhD trained psychology and health services researcher at the UC Irvine Department of Family Medicine. I lead a group called the Helios Lab that focuses on studying ways that we can help create a more trustworthy healthcare system for disadvantaged communities. I joined the panel, I think, primarily because I'm a parent of two children with pretty significant developmental disabilities and very connected to our local disability community. So I have the perspective both as someone that's 1,000,000% aware and knowledgeable that vaccines are safe, effective, and necessary, and also understand where parents have fears and concerns. And one thing I love about this panel, and one thing I think you'll all take from it, is that we'll understand together the urgency of addressing this misinformation and ensuring that people are vaccinated, while also, and the way we're going to do that is through compassion, engagement, and listening. So thanks for this opportunity to be with you.
Thank you, everyone, for such wonderful introductions and, again, validation of why you're all sitting here up here to talk about this important conversation. So the first question I have is for all of the panelists, and some of you touched on it already a little bit, but what do you think, or when you think about the communities you serve, what do you think shapes people's decisions about vaccines and health, whether it's trust, fear, past experiences, beliefs, or where people get their information? And again, this question is for all the panelists, and we can go in the same direction. Okay, go ahead.
I want to take you to the daily life of one of the moms or grandmothers that actually brings their kids to my clinic. They're working 2 or 3 jobs. They know the importance of healthcare, but when they go to the supermarket, they also know the power of the purse and they understand hunger. On the other side, they are living on this mesmerizing social differences where maybe there's no a lot of green spaces. Maybe the security of their home, house, or themselves is actually tainted with a lot of things. And we need to actually picture that patient coming to our clinic. Then all of you are right now invited to my clinic. The conversations that they have, it's not that they actually will open Fox and after that CNN and compare it to what actually Kaiser Family Foundation has said and compare it to the talking points of X, Y, and Z. They're really getting the information in tidbits on social media. That's a reality. Or maybe in a local language, culturally appropriate channel, Univision, Telemundo, choose whatever, but there are snippets. Then snippets. At the moment that we have that, we are not actually having a conversation with our patients on very true science or evidence. We're talking about feelings. Who actually went inside the influencer, that went inside of their hearts and souls to actually create a feeling? Then at the moment that they come with me, they are like, I have heard about autism. I have heard about aluminum. And my favorite one is graphene. I have heard about graphene. And sadly, after 2020 and I agree completely with you. We lost that virtue of communicating with our communities. Why? And that's our fault as healthcare providers. We were not hearing them. We were not listening. Do we need certain vaccines? 100% yes. Where we're hearing their feeling of being trusted, or the other one that is very important, giving the information to actually decide. Then my job right now, with when a patient comes with me with all these social drivers of health that is actually creating a void between me and them, is making sure that they have enough information to decide. And we need to change the way that we have been practicing healthcare, because we are there as servants and we're not there as a judge. We're not there as a coach. We're not there to actually inform them what should they be doing. We need to be partners. And we need to be humble. That's the other one. Then that's where my patient, with all these social drivers of health, we need to actually bridge that part with culturally appropriate, linguistically coherent information, and spend that extra 5 to 10 minutes to make a difference for them.
Thank you, Dr. Shapiro. Anybody else wants to weigh in?
100% agree. I feel that like when there's several different patient types, right? There's a type that you mentioned, but then there's the type that is really trying to get the information, trying to figure out what they read all these books, they read all these articles, maybe they don't have a scientific background, and then they see all the social media that helps summarize it for them. And now, even beyond social media, we have AI. So it's a very digital world. It's not a human connection. So if anything, we need to really focus back on the human connection. What makes us human? We have to admit we don't know it all. And maybe, yes, there are questions we need to answer, but we need to really look into the science. How then do we ask those questions scientifically so then we can get to an answer? But in the moment where we don't have that certainty, we do have to partner with our patients, hear their fears, and find a path that's right for them. So you have that patient who has everything. And what I've heard, and I mean, I've been at fault too, right? The patient comes in and says, I have this, look at all of these PubMed articles. It says X, Y, and Z. Those might be biased. I may not have the time. Or early in my career, I would say, wait, I went to school and you're questioning my intelligence, right? And already right there, you've lost your patient. Even if you didn't say anything, if your body language says you're dismissing what they're bringing to you, you've lost their trust in your care. And I learned that early on. And so then I had to change my ways, but it took so much time to then gain their trust because it took more conversations. Let's talk about this article. Let's hear a different viewpoint. And many times families don't have that precious time. It costs money every single time they come to see us, right? To just get there, to take the time off. So then you've lost them with time. So then we do have to communicate differently and realize not everybody's coming to the medical community for their clinical visits. They don't have the access, they don't have the ability, they don't have the time. So how then do we, go to our other partners so that they are getting the information that they need to make that decision? And that's where we have community partners, schools, that we all need to align to try to help one another out and find the gaps so that our community feels that they can sift through this information and determine what's right for them. And again, we know with social media, AI, when you're on social media, everything becomes biased. You start looking at a certain image you like, maybe nutrition, and then it starts biasing everything that it shows you to whatever you've been spending more time looking at. And that is not a conversation. That's making you more polarized to a certain belief. And the only way to break that is to have regular conversation.
One of the factors that I see, because again, I mentioned that I get called in when they don't turn in the vaccines, because if they're just turning everything in, it doesn't reach my desk. So I go in to talk to the parents. I either call them or I see them, And the first thing they think is I'm walking in to change their mind. And I have to put them at rest as soon as I walk in, that I'm not here to judge them, to attack them, to convert them, because I understand they love their children and we're all on the same page. I want the best for their children in the schools and they want the best for their child. And whether or not we agree is different, but we both want the best for the child. So if I come in already with the attitude that the parents want the best for their kid, it changes my demeanor and how I listen to them when I find out. Like I ask them to explain to me, like, so what's your situation? And like you said, there's a lot of, it's not always hesitancy. Sometimes it's barriers, just simple barriers. Like they don't have the copay to go to the doctor. They already used up their physical for the year. And then the healthcare provider can't give the vaccine without a doctor visit, or there's just things like that are transportation. They not open during the hours the parent can take them. There's a lot of different physical reasons, and then moving on to the hesitancy for other reasons. And I think it's super important, again, to listen and to find out what it is for that particular student, because then that opens a door to solutions and a discussion.
I'd say that common ground is that combined caring, right? As a provider, that you can show the family you care about them and their children, the rest of their family, and that's the starting place to engage them, and then listening, empathy. That's how you build the trust that you really need to communicate what is a very complex medical landscape. I mean, we have new vaccines, new things we learn, and it's complex and it can be challenging to communicate. And if you don't have that trust, then it's really very difficult.
Yeah, all such great points. I think thinking about like where does vaccine hesitancy come from? Maybe I'll comment from the perspective of a parent, and then as a researcher. As a parent in the disability community, I think again, I am 100% sure that getting my kids vaccinated is the appropriate and safe and correct and effective thing to do. And yet then your child develops autism, an autism diagnosis, and you think, well, like, what if there's like a 1 in a million chance that the vaccine was the thing that did it? Or what if we were the outlier or the exception to the rule? So it can make you nervous about the possibility of maybe vaccinating your next child or encouraging someone else to vaccinate their kid. And so now, my wife's a very diligent documenter of all things in my life and our lives, and she noted that our son received the MMR vaccine at 14 months, and his kind of developmental regression began at 11 months, and that'd be a pretty nasty vaccine to give you autism 3 months ago. So in other words, we could feel very confident that what occurred wasn't attributable to the vaccine. And then that became kind of an anecdote that we're able to share kind of in our community of disability parents, and it's just an anecdote. It's not the same as the data that actually provides the evidence-based foundation. But it's something that I think can help encourage people to consider vaccination for their kid. As a researcher, I think there's a principle in psychology that we call the status quo bias, that we tend to not wish to take on something new or make changes. And I think we all know about this in our own lives, definitely in our partners' lives, that we're hard to change. And our ability to change or to take on something new diminishes when the inputs are more complex and when our attentional window is more narrowed by some of the challenging life circumstances that some of the other panelists talked about. So if I'm experiencing food insecurity, or if I'm worried about immigration enforcement, if I'm worried about, for me, it's like when I got my COVID booster one time, I felt sick the next day and I just had to miss work the next day. Well, I get paid time off. Not everyone has paid time off. What if someone's worried that I'll get sick if I get a flu shot or a COVID shot? All these things are things that might enter someone's mind and narrow their openness to trying something new. And that's where it becomes really important that we don't just pile on and add pressure, but really be open to listening. So this is why many of us hesitate. In difficult times, hesitancy doesn't mean no, it means not now. And the not now can feel a lot safer than yes.
Thank you, Dr. Bowman. Jackie?
Thank you. Everything y'all said is already covered, the social drivers, the accessibility, all of that. And I think part of this whole thing is people fear that, we're making money for them to get vaccinated. The whole profit component, they're making money off of me. Although, when they go to the influencers and all that, they're also making money on untested products. But apart from that, when we really look back on everything that you all said, from my line of work, I teach the plain language component, and part of that is understanding that 1 out of 10 people understand health information at a level where they can actually take action and want to engage. So that means 9 out of 10 people who come in to see you all, they are not gonna really understand or really perceive the information as we do. So I take a lot of documents that come through about outbreaks often, the measles outbreaks, or there was a TB outbreak. And, doctors are writing this, and I get it, we're all here, we all kind of do public health, we talk in jargon. But then I look at that and I'm like, oh my goodness, I have to do a lot of work to get this message to be digestible. And if that's happening in a document, I really wonder what's happening in the offices sometimes. I mean, if you're not conscious of that, right? We obviously want to show that we have some sort of, knowledge and authority, but at the same time, the humility part comes in play where we need to remember that if 9 out of 10 are coming in to talk to us and they're wondering what we're saying when, we're trying to relay information for them to take action, that means that, we have to change. I mean, in a perfect world, people would get education, health education, since they were in elementary school, and they would understand public health in a way that, is effective for everybody to take, accountability and collectively take care of each other. But we don't live in that ideal world. So what can we do? And it's part of that plain language component that I will be talking about as we move forward in this panel.
Thank you. I feel like you've all started the foundation and the basis for the rest of the conversation. And we probably could end here and people would have a pretty good idea of what the message is, but we have additional questions for you to go a little bit deeper. I also want to acknowledge that we're here today representing vulnerable communities because we represent community health centers and then collectively across the board. This is the community that we assume needs more of the help. But I think what Dr. CK introduced as well, and some of you also touched on it, is not everybody comes in. I could be that 1 out of 10 person that came in with all my research, came in with all my questions, documented everything in all my questions, and it's not necessarily just about vaccines, but health in general. And so I think what's at the core for me, from what I'm gleaning from, is we need to establish that trust with whoever it is you're engaging with, whether it's the school nurse, right, the county official, my primary care doctor, my neighbor, who may have more information than I do. I think that we need to make sure that we understand that we acknowledge people's questions and concerns and fears, because without that, I don't think we get to the next step, right? And then acknowledging how many touch points is it going to take for me to say, yeah, that makes sense, I think I'll do it. And I think we're representing different areas in the field that we're lucky to have, because the communities that we're targeting, they're not just coming to the community clinics, right? They're at the schools, they're at outreach events. Each and every one of you play that critical role to get them closer to that decision that we want them to make. So that was my little soapbox, but thank you so much for, again, laying the foundation and the framework. The following questions are going to be a little bit more of the same, but maybe a little bit deeper. So for example, Dr. Belamek, you bring a dual lens, as you stated, as a parent and a psychology researcher. From your perspective, what other factors can people, including other parents that may have those concerns, what other factors make people hesitant or resistant, right? Not just those particular fears, but there must be others that I think contribute.
Yeah, I think that's such a great question, and I think that I talked a little bit about hesitancy already, and I think this notion of resistance is a really important concept as well. And I think we've all been in experiences where we have bristled against something that was said, something that maybe challenged a point of view that we already have. In fact, it's part of that same status quo bias I was talking about, where we're reluctant to change. And sometimes if we kind of come at something with a lens of you must change your mind, it actually builds our defensiveness against that idea. And I've definitely seen this in research and in the disability community. But I really want to emphasize that the barriers that people face to accessing care and accessing vaccines are critical barriers that impede people receiving their vaccines. And there's this spillover effect to it as well, that when you are feeling overwhelmed or pressured through economic stressors, immigration enforcement, worry about paid time off, these kinds of things, it narrows your ability to be open to new ideas. And I think that in that way, each of us, our sources of hesitancy and resistance are highly individualized. And the only way that you can really remedy things that where they're highly individualized is having close relationships with people. And we can't each have a close relationship with everyone in our community. So how do we encourage people within their own families, their own close social networks to speak out? And I think that the voices of the rare case, the negative outcome, the worry, those tend to present a lot louder and larger than when everything goes smooth, right? I don't know. You don't tell a story about, well, listen, if you had like no traffic driving to work, you might tell that story. But if you just had like average traffic going to work and you weren't late to work, you wouldn't say, hey, everybody, it was just average traffic today, right? So the stories of these okay experiences are I think are really useful. And I think the reason I mentioned the story about my wife's note taking about the timing of when my son's symptoms began versus when the vaccine was addressed wasn't that our anecdote could prove to anybody that it's going to be safe for your kid. But what it did prove is that even Egghead Bilomek, the professor, worried for a second about this and looked. You know what I mean? That you're not crazy to wonder. And then it can really set the stage for a healthy conversation.
Thank you so much for that, Dr. Bilomek. I'm going to focus now my questions to both Dr. CK and Dr. Zimmerman, given that we have groundbreaking information, and at a time when shifts at the federal level, including policy decisions such as the ACIP, the Advisory Committee on Immunization Practices, met yesterday or meeting again today. They're placing unprecedented pressure on our scientific and medical institutions. The trust in medical experts and science and in those creating life-saving innovations is being challenged. From your perspective as county health leaders, what strategies can we take at the systems level and as individual providers and agencies to maintain credibility and strengthen trust in public health? Already this morning, as I welcome folks in, everybody wanted to let me know, did you hear? We're now not going to be able to give this vaccine or that vaccine. It's like, wait. You can't jump to those conclusions just yet, right? Because it's a process. So I'd love for you to address what happened at ACIP.
I watched part of it. I didn't watch all of it. So I don't know, maybe Dr. Zimmerman, if you watched all of.
I mean, I didn't watch it, but I certainly heard the vote, right? And I think, it is unfortunate when science and the evidence becomes politicized, right? From a public health perspective, we like clear and consistent messages that we've looked at this and we've looked at this over years and years. And what's happening with the CDC and ACIP is we're no longer getting a consistent message. I mean, the state has made changes and said we will be following the state health department's guidance because that continues to be following the evidence. It appears that the decision made this morning is not supported by the evidence, and I think that when the messages fracture, it makes it much harder to communicate with people. right? It makes it much harder. It raises doubt, right? But someone else said this, right? Just like the impact of social media, people raising doubts, that all makes our job more challenging. We need to redouble our efforts to be consistent, to be clear, to talk about what we know, what we don't know, to be honest with people.
Yeah, it's going to require a lot more communication, a lot more strategy on how we get more connected with our community to have those conversations. Because the ones who really need to hear this are not in this room. And so how do we connect with them when they've got busy lives? But there's a lot of doubt, yes, that it brings up. And unfortunately, it also comes from people who are at high levels and who are now part of ACIP. So if the majority of our community across the nation are listening to this, whatever side they are on, we have to acknowledge that we have to see all sides and hear all sides and somehow get to a middle where we can support our community. The power is local. It's not national, it's local. And so we have to own how we communicate and connect with our community so that our community can then have confidence in what we recommend or what the state recommends. What I did hear also on the talk was that I think there was a mention of that states have specific legislation of whether or not they're going to follow CDC, right? The Western Health Alliance has already come together to make a stance that they want to support ideas from the scientific community. So that's where we need to rally together also to help with that effort of energizing our community to understand what science means, translating the science so that they can consume it and understand it and feel comfortable with it.
Thank you both. So again, I want to be able to translate that. So at this point, these are just recommendations. Nothing is changing at the state level, at the local level. We're still adhering to the recommended schedules. So I just want to, for posterity purposes, and we're recording this event, and for those of folks that are going to see this later, we're not saying that things are changing immediately today.
Right. So when the ACIP meets, they give their recommendations to then the CDC director. And from there, the CDC director then has to make the recommendation. And then from there, depending on your state legislation, that then dictates what happens next. So there's still a lot that needs to be decided. So nothing changes as of today. There's just conversation.
Great. Thank you for that clarification. Anybody else want to add in or weigh in on that? Okay. Well, thank you for that. And again, we've already addressed the fact that there's a lot of misinformation and disinformation and where people actually turn for guidance. Many of you touched on that. So I'd like to ask Jackie first if you wanted to add more on that, specifically on what influencers, how influencers influence, folks accessing the information, and then anybody else who wants to add in as well.
Yeah, I think this is a really important question because it touches base on a lot of the stuff that we talked about, the accessibility. A lot of times we hear like, go talk to a doctor, and doctors are still the number one trusted source for people. People still trust their doctor, and research still shows. But the problem is, how do they get there? The copay, the everything we said. And so between the time that they're waiting to talk to their doctor, I've had that experience where I'm like, I need to know now. So I go online. And thankfully, when I go online, I have that understanding of what I'm looking at and whatnot. But still, when you're having anxiety, when you're like having a worry about something that you're going through, if a person is looking online, they're going to want an immediate answer, and they're going to go on social media. They're going to go in to see what's going on. And between that time where they can see the doctor and they want that answer, they already went down a rabbit hole. And this is where, the algorithm and everything starts to affect them as well. Because, it's the accessibility, how quickly it is, the relation that they see within the health influencer, how they talk to them. They talk to them like a person. Like, have you ever felt this and have you ever felt that? Well, your doctor doesn't want you to know. So then, people are like, oh, okay, well, why should I even talk to my doctor? Or when they go to the doctor, they already have all these things like, hey, they're very combative in some way. And unfortunately, that makes it hard for you guys to talk to them. But this is the time where I have seen in the work that I do right now with the community health education and linkages that right now LA County Public Health has, there's an info line. So it's people can call the info line and get in contact with someone who's a healthcare assistant, and they can answer questions. So between that time where they're waiting or whatever, they can call that person and be like, hey, so I have this question, and they can give them information and answer that question. They're trained to do all that. Or they can relay them to a department, let's say Department of Mental Health or Environmental Health or whatever it is that they have a question on. So that's a way to kind of bridge that gap between I can't wait for my doctor and obviously going online. They know that there's an info line. I mean, this is a new thing. It's been like a year or so that it's been on, but there's a lot of calls, especially with COVID-19, dengue fever, all these other things that have been trending and happening in LA County. So we have that. And then there's also the Public Health Ambassador Program that I manage. And that one is, you have people from the community. There are a lot of parents, especially parents, it's for schools. They come in and we give different topics on different things like heat waves and like the virals too, like what's happening. We just gave one on, how to protect yourself during the holidays with viruses and stuff like that. Very different topics throughout the year. And what these parents do is, or just community members, they come and listen to what we say. They get, become the experts in that area per se. And then they relay that information to the PTA, to their community, all of the people who are around them. Now we have a snowballing effect, right? Like there's that kind of also that bridge. So we need to find ways like that where we can have community members, especially community leaders who are trusted, who have friends and family. And we always ask them, what are you going to do with this information? And they tell us, oh, I'm going to print flyers. Sometimes we give them a packet of stuff. They print them on their own, they distribute it, they talk to people. And we also know that in research it shows that is your doctor, people still trust their doctor, but also family and friends or their immediate close people who they also turn to. So we have people in the community learning all these topics of public health from experts in the department. They're able to now also collaborate with us and then be part of that bridge that, if you have to wait for the doctor, if you have to wait for a community center, at least you have information that's not just going to immediately be a health influencer who kind of wants to make money off of you too. So, that's kind of one of the things that we can do. And like I mentioned, plain language for us is important. So we can also relay that information when we're speaking. So it's a community component, and then it's our component as professionals to take the responsibility to know how to speak to the people that we're working with.
Thank you so much for that. And I was looking at the room and I don't see anyone from Latino Health Access, but I'm going to give a big shout out to them as an example of what you just described. During the pandemic, we had the vaccines thanks to the county. We had the providers thanks to all of our network. We had all the volunteers ready to go. We popped up sites all over the county, like, we have your vaccine, here we go. Nobody was coming. Well, a lot of people were coming, but not the hordes of people we thought would show up for it. In comes Latino Health Access, right? They have a cadre of community health workers who are already embedded in the neighborhoods that were most highly impacted. And they were the trusted source that they would open their doors to talk about the vaccine. So we had the resources, but we didn't necessarily have the trust, especially, during the pandemic. And so I think that's more evidence to show that people are going to first trust people they know, that speak their language, look like them, have had prior experience, with whatever it is that they have questions about. And that would be the first layer of access to information. I referenced earlier about how many touch points do you need to actually move and make a decision. I think it starts, with the local friends and family, and then eventually you go to the white coat and say, okay, can you validate all this information I bring to the table? So sorry, thank you for inspiring me to say that. Dr. Shapiro.
I want to take a stab. And whoever is a nurse, doctor, please just put your fingers in your ear. The real secret in the communities, and especially right now, enforcing what you said, our community health workers, our promotoras and promotores, they kick Tushi. Why? Because sometimes as general practitioners, nurses, doctors, and we're doing our thing, we know how to save a life, but sometimes we do not know how to communicate sensible things. That's a reality. But when we combine this type of conversations with the experts that actually can tell us, well, right now, for example, if I tell you, close your eyes, and I'm going to do an exercise here with you, and I'm closing my eye also if you feel comfortable. If I tell you safe and effective, does your heart rate go up? Probably yes. Probably yes. Yeah, exactly. Then why? Because it's already embedded with a lot of messaging that it has changed from 2020. And right now it has a different aspect of it. But if my mom, my grandma, my promotora actually comes with me and go like, you know what? You want to be with your kids in the holidays, right? You don't want to spend like time in your bed or with complications. You actually need the money to work or your kids to actually be running in soccer fields and stuff like that. Then that's actually what we need to be learning. And by the way, it seems that we forgot absolutely everything that we created during COVID-19 because there were a lot of miracles. The miracles of actually going deep in communities that usually didn't have access to information in a culturally and linguistic matter. And it doesn't matter if you're from OC, Santana, or in Anaheim, it doesn't make a difference. All of us actually, we perceive different things and we are biased, and that's part of life. But we need to use those secure messages. That way, and I love how we were all talking about the touch points on reinforcing the same thing. And at the end of the day, we all know that parents have the decision to for their kids. I cannot promise them anything. I will never give them the lottery ticket because I don't even have it for me. Right? But we can promise them that we're acting with the best intentions and making sure that we're checking our biases, egos, and everything else, and make sure that we're partnering up to move forward, because we have a lot of the other conversations that, what did they tell in Denmark? That was a big topic this day, or what's happening in other places. And we need to go to the local part of it and make sure that we are there, because it's also fluoride water. It's also vaccines. It's also mental health. And it starts bubbling up with a lot of different things that will be important for our community. Then I agree with you. There are influencers, but we are here in this room experts. Then there's a huge difference on where we're coming from.
I think where we can do better and learn is tell our stories better, right? Tell the stories, the personal stories where, yes, we looked at the timing, and while we want to easily make that connection, when we actually looked more deeply, there wasn't a connection. But it takes someone telling that personal story for someone to feel touched to maybe then change their mind. But how do we tell our story? So we as clinicians weren't learning that. We were learning how to save a life right now. Like, here's our diagnostic criteria. And none of that is storytelling part of the treatment plan. And that's where we were missing the boat all along. So we also need to learn better on how we can narrate a story, but that's where we need our partnership with the community, because the community knows how to tell a lot of stories that can inspire.
I was just going to say really quick too, you only have like 15 minutes with your
Right.
doctor. So it's like, I'm there to get checked up, you check me up, and then I'm leaving. And there's no time for those stories, right? So that's kind of where like the public health communication, all that comes important, so we can support physicians in being able to get that trust, right?
Yeah, so that means like every opportunity we can in the environment needs to be utilized. So even in a clinical office, physicians aren't going to have the time. We want to get back to, okay, look at the diagnostic criteria. So then it takes that front desk. Hey, how are you doing? Did you want something to drink? Oh, they have the stories to tell about their own personal experiences, but that can go beyond the clinical setting, right? It could be where people are gathering to have their festivities. It could be at the churches, right? Where people start sharing their stories of how they're caring for their families and making sure they're healthy through a season. Sharing how the positives of what vaccines can offer. But we have to keep in mind that the negative stories are going to ring louder. Even if there's not as many, they're going to ring louder. And unfortunately, it's just more of that. It's how we survived. It's a survival technique of our own brain. Our brain will pick up on anything that is harmful and cling on to it so that we then don't get into that situation. But we have to understand that about ourselves.
Agreed. Anybody else wants to weigh in?
I just reiterate, this is the role of community health workers. They're in the community. They have more time, right? It is very hard for providers, given how much you need to go through and how quickly it's really challenging. And people who extend that communication into the community, and have the ability to talk to people where they are, I think are really powerful.
Just want to add on the community health worker model, I think, and it just speaks to all of this. Well, listen, we talk about the importance of building trust. And when we think about building trust, you could think about, someone who's really, really good at building trust quickly is a con artist, right? Is someone who's trying to sell you something. And yet that trust is broken, right, all the time. And that broken trust is damaging and creates skepticism and reluctance for years to come. And so our goal shouldn't be to build trust, but to cultivate trustworthiness. And I think the beautiful thing about community health workers, when Latino Health Access trains their community health workers, they wrote the book on this. It's called Recruit the Heart and Train the Brain. And what they really focus on is this concept called accompanimiento or accompaniment, where you spend time with the client or the person that you're outreaching to, and you see them regularly. You show up at that grocery store outreach events every week, and that they see you, over time. And it's the time is where the trustworthiness is generated. I can get ChatGPT to write a perfect argument for me, factually accurate argument for one position, and a factually accurate argument for the exact opposite position. And it did it in 13 seconds. That is not trustworthy to me, right? That is something that I just know is telling me what I want to hear. Trustworthiness occurs from spending time with people over time, listening and understanding their priorities, and then being there for them, and where the relationship and the collaboration is more important than the outcome.
I love that. And I think during COVID, I learned that the hard way. So during COVID, if you don't know anything about me, so I was going on this realm of wanting to be this wonderful integrative primary care physician who knew everything about how to help you heal or seek wellness. And then COVID hit. And then I saw all the inflammatory markers skyrocket in some of my patients. And so as I was telling them about different opportunities of how they can make themselves well or get through this, I kept hearing my patients want more supplements or more information. But at the end of the day, I'm thinking, that's like peeing on a wildfire. Like, it's not going to put out all that inflammation. And at the end of the day, we need to find a way to support ourselves. And in my mind, I was thinking prevention. So vaccines have demonstrated over decades that they prevent severe illness. Now, it's not 100%. Not everybody's going to, everybody's different on their genetics, and some people will gain immunity serologically, and some people we don't see that serologically, but we know that there's some cellular immunity. But what I know is that when I was trying to defend everything about vaccines for my own family members, extended family members, even outside of the country, at the end of the day, one other person said, it wasn't the scientific data that you gave me and all the counterpoints, and this was days, this was weeks, all the counterpoints I gave from even a scientific, but also from the integrator perspective. It was your dedication to check in with me a couple of times a week to see where I was at. You showed me through your time and through your persistence that you care. So it wasn't the data at all. It was your presence and engagement and connection.
Thank you, Dr. CK. I want to add to that as well. And I know we're talking about Latino Health Access a lot, but I think it's relevant. The community health center movement has been around since 1965. We are strategically located in communities where the need is the highest. When COVID hit, it was as if we were preparing for this for 50 years because we were exactly where we needed to be, serving the community that was being hit the hardest, and we needed to save lives. And so again, I said we had the vaccines, we had the providers, we had the facilities, we had the wherewithal, but we didn't have the trust that we thought we had in the community. Even our patients were hesitant. But Latino Health Access, I think they just celebrated the 30th year. So they've been preparing for this moment for 30 years because for 30 years they had been building that trust in the community, attending the cafecitos, attending, all the events, the tamaleada, they're making tamales sometimes this month, so we're going to join. But again, they've been building these relationships, and all it took is for them to either parade down the neighborhoods or parade down 4th Street with, everybody saw the COVID costumes they wore, right? I mean, all they had to do was that once, and the right people started showing up to our events. Because when we popped up our tents, the wrong zip codes were coming to get the vaccines, right? Folks they knew what was happening, they wanted the access to the vaccines, but we were trying to give the vaccines to the folks that were dying in really high numbers, right? So again, more evidence to show that it does take time to build those relationships because you need multiple touch points to get to the decision that we want. So thank you. America's ears may be ringing. Anybody else want to chime in on that end? So we've spoken for at least 50 minutes or so on this, and we've explored different perspectives. We've examined root causes of hesitancy and discussed what shapes trust and informs decisions. Reflecting on everything we've heard, can you tell us what an aha moment has been for each of you that we can then take back on either the county-wide, health system-wide, provider or organizational level to move this dialogue to some real action? Just think about an aha moment for you.
I can start this, and actually was inspired by Dr. CK. As doctors, we have our egos, as you can imagine, like regular, normal things, right? Like small place like here on the sky. And when we start actually reading the books and we're amazing and memorizing, reciting, trying to figure out stuff, diagnosing and connecting the dots. But in 2020, when we have all this stuff, and we need to go back to that moment because a lot of the things that we're living right now started there. And it's actually not the epidemic or pandemic of influenza or COVID-19, or it was actually the problems that we have with information. Why? Because I thought that because I was wearing a white coat, people will actually hear me. And boy, I was wrong. Boy, I was wrong. One, because it's not about the white coat, it's about the relationship that we build and the trust that we create. And also, honestly, being humble because we're all humans. Then that was one because I spoke with kids, I spoke with parents. We were doing a lot of cafecitos there also, and making sure that there was something moving. And when I understood the port, and we were actually talking about this morning, I started actually seeing myself as a waiter, really, as a waiter. And how does that function? And we were talking about that part. When they come with me and you go to a restaurant, you go in, they present to you a menu, choices. And maybe you like fish, maybe you like this, maybe you're vegan, you're in keto, whatever diet you're in, you will have a preference on that part. And me as a doctor, from being that coach, that lawyer, that actually goalkeeper, I became a humble servant. That actually gave me the perspective of actually doing the things that I was trained to do. Be empathetic, understand where they were coming from, understand social drivers of health, because we need to continue talking about that part, and also access to healthcare and information. Because I honestly, and we have heard it here, I'm there for like maybe 20 minutes, but mom and dad are there for 23 hours and 40 minutes. And that's in one day, and you can multiply that part. Then I always come with that menu with them. This is my best dishes. These are the specials that we have today. But most importantly, what honestly, do you like dessert? Do you want to start with something? And they have the choice to actually cater that menu to them, one, or the option to actually just stand up and choose a different restaurant. And that's also okay. And my job right now changed from me giving the orders to me giving options and being a partner on that growth of that child. Because at the moment that we do that part, we're creating that trust that we were talking about, that conversation, and I'm trying to remember specifically the phrase that you use, but we need to create that trust not on those 15 minutes, but a relationship for the future of our community. And that's kind of,
Thank
you were seeing Dr. Waiter over here.
Thank you.
I think my aha moment was reflecting back during COVID and how we do need to do more in partnership with our community health workers and our community to have those conversations with our community, because health is in the community. It's not in that 15-minute visit. We were trained that we were going to help, provide health in that 15-minute visit. But reality is everyone is in the community with their families for the 23 plus hours, or they're at work. The other aha moment came as a patient when we're struck with our own challenges, with our own medical conditions, and we want to be cared for. I guess the way I can word it is, would you rather be cared for? I don't know if anyone watched House.
Yes.
So there was this physician who was really into the numbers, but really stern. No, this is the way it should be, but didn't really have any empathy. Or do you want to be cared for by the person who's going to sit next to you, hear you, listen to you, present you the options? And when I had my medical scare 3 years ago and had the cancer diagnosis, I found myself wanting to be cared for by the one who was willing to listen, not so much all the science, which surprised me. I always thought that I would be the more objective, but at the end of the day, I wanted my team to be on my side emotionally. So I feel like that probably is a commonality even with our community and our patients.
I think as far as the schools go, I think I wish we would work together more, the healthcare providers in the schools, because we're on the front lines and people their kids are in school. So if you want to make an impact on health, it's just like we were really involved with COVID, because the people are at the schools are usually the center of the communities. So I always do try to collaborate, like with the cases. I have cases that I'm working on that I don't want them to miss school. I want them to catch up on their vaccines. I usually try to reach out and get a release of information, and I try to partner with the healthcare provider and the parent, the healthcare provider, and myself. Okay, here's the plan. They want to spread them out. This is a realistic plan for this student, and can you help us out by writing a temporary medical exemption? I know the healthcare providers don't like to write them, but if it in the long run means that they're going to get them, it's one way to work with the families. But also, like a discussion like this, I would love to have the local pediatricians in my area offer some kind of seminar or to the parents of the school district, and be hosted by the school, and the parents can actually see their providers that are in their community. I think that would be wonderful. And so just partnerships as a partners, and realize that you guys are welcome to call the school nurses if you're having a case that you're working on. It always serves the student better when the nurse at the school, the certificated school nurse, is working together. So it just helps with any health issue that's going on with the schools, the coordination of care. And so I would just say, yeah, let's be partners.
I'm going to do a point of privilege here. Yes to your invitation.
Yes,
Yeah,
over here.
we can actually that's the talk, the thing that we were talking about, connecting the dots, and you saw the magic that just happened here. Then we'll figure out how to bring those pediatricians to you.
And I wanted to, I know you want to jump in, but I also wanted to acknowledge, Natalie, that I keep referencing the work we did during COVID. We could not have done it without the schools, right? At the end of the day, right, you have this captive audience of the kids, but they're not the decision makers, right? We needed to get to the parents and we needed a safe facility. So almost every event we went to was at a school facility because that's a trusted entity. I absolutely agree. And we'd love to continue to do this, take the show on the road wherever we need to. Jackie.
I'll just go really quick. Yeah, my aha moments. Well, it's really interesting because when I was choosing what to study after my psychology bachelor's, I was looking into health psychology, medical sociology, and all of that. And I was like, I wanted to make an impact on the macro level, right? But I was looking at everything that we talked about, the social drivers of health. And I was like, a lot of this is systemic, like from systemic racism to like the economic issues, all of this, right? And all of this has layers of it. I don't think we had time to touch about it today, but because we want to talk about the common ground. At the end of the day, everybody, when it comes to information, it's a challenge to just even talk in plain language, but also culturally relevant and in recognizing the history of so many things that have happened in the research, right? Or things like that, like all of that. But even regardless of that, we have to take that in mind, of course, but also find that avenue of how it is that we work with it now. Like, how do we think about it now? How do we build that trustworthiness? I remember that word right now. He said it right. And it's acknowledging all of that. And every time, you go from, for me, health education, which I have a lot of people in the community, to then how do I get those people to get to the offices, to work with, nurses and school nurses and having that menu open. Because I think it's all of that. I think it's all of that. But at the end of the day, too, like I mentioned earlier, taking all of that in mind, being a multifaceted, public health person, a provider, and taking that with that, understanding that, taking that to be an empathetic person, first and foremost, before we put on the white coat, before we put on that title. And then really looking at that language. I'm going to go back to that language, the component of how we speak. And I think an actionable item for everybody. Let me look at just the website just to make sure I'm giving you all the right website. But there's trainings or there's information for plain language. One of the websites is publichealthcollaborative.org. You can find things on there like communication tools, public health, plain language for public health. Within my department in LA County, we do have trainings for our folks to be able to learn how to do this. But there's tools out there for everybody, and I would advise everybody to not only look at those tools, but implement them within your facilities, within your professions, and make sure you all public health, plain language champions. That would be an actionable item. I think that we can all take from this room to better improve the way that we talk to our community, but also the way that we present ourselves as people when we're talking to people, because that's what a lot of folks are appealing on when it comes to social media.
Thank you.
I mean, I think not just how we talk to people, but how we listen to them, right? We've talked about empathy and to acknowledge, I hear you saying you're afraid, right? And saying that's okay. It's perfectly normal to be afraid. So let's talk about that now. And that's the talking piece. But how we listen is really important.
And I'll just add, I think my aha moment was also a maha moment. It was a more recent thing. And that was basically kind of working in a university. I just felt that, listen, not everyone loves every university, but that there's such a positive feeling from the community sometimes about universities and going to graduation and experiences of our students and families and the thank you cards. I thought, man, people love us, And then kind of with the new administration, with a lot of attacks on universities and restrictions being placed on universities, funding being cut and rescinded over DEI policies, things that have been the norm, things that are really appropriate, and some of the things that we do best came under attack. And I felt very kind of threatened and challenged by that. And but But I think, there's some extreme cases of people that really are trying to foment that. But I would say very broadly, the rise of MAHA, which I think there's a lot of important ideas in that movement, and even some of the things that go into like anti-vax and anti-science sentiments really come from community members feeling like they really want to start checking the receipts of these experts that keep telling them stuff and maybe don't listen and show them enough respect. And what about the things that have been valuable in our own families and our own experiences that work? And do we really need to do this? And all the things that happened very quickly during the COVID-19 pandemic, people maybe still feel some trauma from that, right? That schools had to be closed, and am I supposed to wear masks or not? And is this vaccine, all these things. So I think all these things can come from a legitimate place. And I just think that it just becomes really, really important that we avoid reacting to people in a way that makes them feel like we think they're part of a bucket of deplorables or something like this, that they're a bad person or someone that's trying to create harm by having questions. And I think that just has become really clear to me in these last few months.
Thank you, everyone, for all of that great, again, building on the foundation that we started. As I go through my questions, I feel like we've already talked about this, but given the fact that we're about to enter the holiday season, a lot of us are going to go back home or wherever it is that we want to celebrate with, and we're going to be faced with these type of questions. So would anybody like to add any more insight into how do we address our neighbors and families when they come up with these type of questions and concerns?
I do want to talk about that because my mom has a lot of little gatherings for her friends, and sometimes I join them, and I'm like probably the youngest one, but it's fine. When they have conversations about different things, I find it really interesting because I'm listening. I'm listening to what they're saying. I'm listening to what that's the thing that I also notice. Like the señoras love to talk about health, and they love to talk about different things like that. So when I hear like someone talk about diabetes, for example, like, oh, I got scared and then I got diabetes, right? Obviously, I'm like, oh, well, that sounds concerning, that you got scared and you got diagnosed with diabetes. But then, obviously we know that sometimes it's because people haven't gone to the doctor, they didn't check their blood levels, their sugar levels and stuff like that. And, that's the reason why, later on when they end up in the ER, they do get diagnosed with something because they haven't gone to see what their physical looks like. So I asked them like, oh, I did study diabetes. Would you like me to provide you some information? So I asked them first, would you like me to, like I did this thing, but would you like me to talk about this with you? And when they say, yeah, and everyone's like super close, like just listening. Like everybody literally gets like super close to listen in. And then I talk about it and they're like, oh, okay, so that's how it happens. And I explain how diabetes works and everything. And they get a little more like calm because they're like, yeah, the doctor, they just told me I have to poke myself and I just have to do this and this and this. They don't explain how it works. And obviously as a health educator, that's my job too, right? Like I'm there to explain, but I ask for their consent if they want to hear from me in how this works. So that's kind of the thing. Like if we are experts, and especially here we're talking about health, signal, yeah, that sounds concerning. Wow, yeah, give them that reassurance that what they're saying, is valid. It totally makes sense where they're coming from, and then ask them if they want to hear from you before you're like, actually, I hate that. I say to say the actually. Don't do that. Like, ask them if they want to hear, and then that kind of opens up a door of them giving you consent to do that. And they'll have follow-up questions sometimes too. So yeah, that's just my little thing.
Thank you.
I want to affirm that real quick because, I just see it in the psychology research, that we know that people who value personal autonomy can react very strongly to feeling pressured or shamed or, foisted upon. And it's a strong and it's an automatic and involuntary response. It's just part of our cognition and our human nature. And so I always think that like listening isn't just about keeping our ears open, but it's about trying to create the conditions for people to say the things that we need to listen to. Let's make sure that you can't just listen by hearing. You have to listen by creating the environment where people are comfortable sharing. So I love that idea of inviting people to say, well, do you want to hear about this or not? That's a really beautiful way to do it. And I always like to think about, instead of asking the question, like, why don't they understand? Why aren't they getting this? Where have they been misled? I try to think about like what in a person's world is making the idea of hesitating, waiting, saying no to a vaccine feel like self-protection right now? Like what is the place that they feel like this is not the right time or place for me? And that could be a good part of opening point for discussion.
I love that. I love that. I resonate with that, right? As also, I've gone through health challenges this year, and that's exactly what I wanted to hear from a doctor say, what is it about this particular treatment that you're hesitant on? It's not that I don't understand the science. It's not that I didn't already did all my research, but I'm a human being too, and so I need to be heard. So I love that. Anybody else?
I know some of the things I've learned, my family likes to have really robust political discussions, but we respect each other. But we have very robust discussions, and we could feel differently about different things. And we always still get along. And I'll have friends like that'll be there for dinner, and they'll see me and my brother and my sister, and they go, "And you guys still love each other?" I'm like, "That's the way I've always grown up that way." So to me, it doesn't make sense when people cannot have differing opinions and get along. And you just because someone's a different, and also to make medical care a political thing. Like if you have diabetes, you take insulin. Doesn't matter if you're a certain political party. So some of the things I've learned is, again, which I like the name of this today, this discussion was common ground. We always have a common ground. And the common ground is we all want to live safe, healthy, and robust economy. And so we all want to, when you talk and you all want the same things, then whether or not you agree on how to get there, it makes it less adversarial. So like when you're talking about vaccines with somebody, don't politicize it, like just keep it. And the other thing I've learned is the listening is really important, is why somebody feels a certain way and listen to them. And the other thing is get your knowledge from the right place. And I think if those things, you can differ in your opinions. And I think we just need to have a place where people can have differing opinions.
I know you're all seeing the red screen, but I got permission for one more minute. I have a question that I have not heard answered, and I know we probably meant to answer this, but maybe the physicians but everyone in the room. What about the family and the parents that say, I want the vaccine, but I don't want 5 at once. I don't want 3 at once. I want to spread them out. That's a basis for a lot of the fear that at least I've seen and heard in the community, but also personally, right? If I'm going to have a negative reaction to something, I want to know what that was. And if I have a vaccine that has 5 different boosters in it, how do I know what was I allergic to? So that's a real fear. And I know that at the school system, you've heard that concern. So I want to give that as the last question. And we just got reset.
And I'm hoping that, as we see what's going on the federal level, that more on the clinical side will be more open to that. I know that when I was still seeing patients, I was already going up along that path to say, well, I hear you, let's space it out. But I know that scientifically, and the reasons why decisions were made in the past was because you had that one moment, and we knew there were all these other factors that prohibited someone from coming back. But we just need to be honest about that. We'd love to spread it out. Let's find a way. But if you know, it's also okay to have it all at once if this is the only time that you have the availability to get the vaccines, right? We just need to be open about that.
Thank you.
On my side, I prefer to have the conversation. And honestly, I love when they come with any question, including this one. Why so many? Why should we do it in a different schedule? And I walk with them different things. First of all, asking why. What, is there an article? Is there something that I heard? Is it just a feeling? Figuring out like where they're coming from. The second part is I walk them to the options. And the option that I see a lot is that people that choose that part, the kids start hating me because they come so often, and actually more often that they like not the regular schedule for a couple of months. They start actually hating me because they already see the white coat. They see, even if I take out the white coat, they see all the environment. They know the clinic, and at the end of the day, yes, we want to protect our kids. and there's options, but we need to lay the risk, the benefits of those decisions. And when we lay down that part, most of the parents actually could start that, but at the third time that they see me, they are seeing me more than grandpa and grandma. They go like, well, doctor, my kid is actually suffering because instead of having one vaccine that actually combines a couple of them, he's having 5. Let's revisit that part, and we need to be flexible for that part, because we all know that they have been there for our community, the vaccines, and the way to protect them and being proactive is scientifically based, and it has worked. Then we should also actually, in my brain was going to say challenge, but we need to challenge our own beliefs of how we can communicate for that part and open the doors, because I prefer to have a kid that is vaccinated than a kid that actually doesn't have that protection for the rest of his life.
Thank you.
I mean, I think healthcare is always a negotiation. Different treatment options, whether it's vaccines or medication for your blood pressure or treatment of whatever condition you have. It's always a negotiation, and we're not making people do something. We are there to engage that conversation and talk about the risks and benefits, to try to educate, but also listen, to empathize, to try to get to the optimal outcome that we all want, right? We are both concerned about your and your family's health, and how can we get there, right? So it's always an individual conversation. What is that negotiation? What are your fears? What are your concerns? Where are you coming from? And that takes time. That's work. But you've got to listen and say, okay, these are what you're concerned about. Here's the risk. Here's the benefits. How can we move forward?
Thank you. Dr. Bilomek, you were.
Just affirming, I thought Dr. Zimmerman could literally drop the mic after saying that, because I think that is really the critical point. And so yeah, I just think
Okay.
I mean how reassuring it is to hear all these points of empathy and engagement from these different vantage points.
Thank you. Thank you all for your lively conversation. I think we addressed all the points that we intended to. And so now we turn to the audience, because there may be a lingering question that you may want for any one of our panelists. I don't know who has a mic I'm looking at. So do we have any questions?
Hello, my name is Sarah. I'm a health attorney at Community Legal Aid SoCal. We're legal aid attorneys assisting in our community with health coverage access, eligibility issues. And one thing I heard was that the community we serve, they were afraid to go for an appointment because of co-payments or vaccines. I mean, I don't know if that's like a small percentage, but I was concerned because obviously preventative, there shouldn't be any co-payment, there shouldn't be any fees. If they have no insurance, there's a healthcare agency, community clinic. So I kind of wanted to hear about that. Why, if, and in what sense that the cost is being an issue. And also, I know with the ICE, I'm assuming for the community that we serve, getting the vaccines, probably going to an office might be the last thing, safety issue. So what kind of message, I know the plans, the providers, the community clinics, to send out how it's going to be safe, if they want further information, how telehealth can help. So I just wanted to kind of hear about that as well. And I think in terms of getting the message out to the community, I know we participate in a lot of resource fairs, and I think having, probably you did, I'm sorry, but maybe having a focus on this could be really helpful to engage the community. But I find the resource fairs where I know for our organization, other CBOs get in touch with the community. So question and comments, thank you.
As a community pediatrician working at a community clinic, we have BFC, then, anybody can get the access to those vaccines. And at least on my experience is that any child that actually needs it, we will make sure that we work with them to actually get them. On the part of telehealth and also pharmacy, for example, and not only with whatever is happening right now in the community, we know that each of us like to take care of ourselves in a different manner. Then telehealth is actually playing an amazing role with this. It could be for the informational part with the doctor. It could be with the nurse practitioner. It could be actually with a nurse or a promotor, a healthcare worker, to make sure that we're closing that gap of information and actually converting that part. My dream would be that if someone actually needs a vaccine, we have a system and they can choose to go to the clinic, go to the school nurse, go to actually their community event and actually choose where to get the vaccines to actually open that access. Is it possible? 100%. We did it in COVID-19. We created all these amazing systems and it's trying to figure out how are we connecting the dots to make sure that we're closing that gap and also serving the needs of our patients. Because I love working from like 7 to 7, but if they have the night shift, they will hate actually bringing the kid at 11 p.m. to my clinic to get the vaccines or on a Saturday and Sunday, or then closing that gap and giving that access that you're mentioning. I think that it's something available and possible with the things that we have. The only thing is that we need to make sure that we're organizing ourselves to get there.
I think the co-payment was probably on from my answer, and it was previous to my experience with private groups and how patients who were seeing me at the time, I wasn't part of an FQHC, so people came in and had co-payments.
Oh, yeah, because I know even for me as an attorney, like to navigate the healthcare and knowing what you owe and what you cover, it can be daunting. So I can assume as a layperson, they're probably thinking, even though it's free in their head, they're thinking every time I call or go, I probably have to pay, and not know that in California, in general, you shouldn't be paying for these services. It should be free, whether private or Medi-Cal or Covered California. I'm going to say in general. But so if I think also health education about knowing what their coverage is and that preventative services are free, especially vaccines, is also helpful to do. And I'm from Legal Aid, and we do those presentation about healthcare access and coverage, and clients call us about, is this covered? Do I owe this bill? And so just having us as a resource is helpful. But just want to lay out there, you shouldn't be paying for vaccines. So thank you.
But there always is a cost, right? People's time, at the very least.
Yes.
I think things like VFC and telehealth are we're constantly trying to lower those barriers, but there's always costs, and that's the reality. And for some people, those costs of time are significant barriers for them, and it's challenging.
I also wanted to dispel the myth, like Dr. Zimmerman just said, that preventative care or vaccines are all free. I think that there may be a misunderstanding in terms of specifically COVID vaccines. They were free during COVID, free to the providers, free to community clinics, free to the community. I think in the most recent times when we are asked to go and do COVID vaccine events, not all the clinics sign up for it because the vaccines are no longer free. So the health centers have to pay for the vaccines. Now, we're not charging the community for it, but there's still a cost associated to that. I think it just depends on the type of vaccine, right? So we just need to be open. We need to ask the questions and figure out what vaccines are we talking about and what cost is really associated. I can still say that at the community clinic level, you will not be charged for vaccines, but there's definitely a cost associated to the health center. Yes. Can you give her the mic again, please?
No, thank you for the clarification, but I was talking from the consumer, the member's perspective, and definitely as preventative services, there shouldn't be, but thank you for the clarification.
And while there shouldn't be cost to vaccines, there are certain vaccines, like when you travel, that are not free, like even if they are preventive. So again, we all need to understand which vaccines we're talking about and in what context, and then in what state you're in.
Correct. Any other questions from the audience?
Hi, thank you for the conversation today. My name is Hyun Win, and you all talked a lot about the importance of community, engaging with community partners to build trust and to be trustworthy by the community. Especially during the pandemic, What are lessons learned around community engagement to gain trust and to build the trustworthiness of healthcare providers, health systems? That were lessons learned, strategies that worked, that we're currently undoing, right? Intentionally or unintentionally.
Can I kick us off with that? Because during COVID, we became, and I've said this many times, we became best friends with all of our local CBOs that we knew of from afar. Like, for example, I knew of Latino Health Access, Okapica, Cambodian Family, right, Abrazar. We all know of each other. We respectfully say, I know what you do and I know what you do, and we try and sort of stay out of each other's way. I think that was a mistake because during COVID, we all had to come together and we realized again that we couldn't do the work that we needed to do without everybody, without all hands on deck. And we vowed at the time, we said many times in many forums, we're not going to let this die. Like we're going to be ready and nimble for not if, but when there's another crisis that we need to come together for. And we've been slipping on that, right? Because we're now getting comfortable again in our own spaces and we're doing our own work and we're facing our own challenges. But again, through the equity and OC work that we're doing, that was a formal way of us still hanging together. But we're, as you know, Hugh, right? We're trying to figure out how concretely do we move that work forward so that we don't lose that fabric that we created during COVID, the recognition that not any one of us can do the work that our community needs on our own. We're all great, but we're better together.
Yeah, I was going to mention that the collaboration part. And then someone mentioned the free services. Like at this point in time, I'm not going to say that universal healthcare is like the end all because we have so much cost for like working, like taking time off. But it is a barrier that really does help people get services that they know they're going to get for free. So the collaboration part would be one as well, like they mentioned, but those free services that you're gonna go there, you're gonna go to get the care, and that really helps patients also feel like, oh, we're not getting paid, or providers aren't getting paid to vaccinate you. Like there's this whole misconception that providers get paid because they give you X, Y, and Z, when obviously the intentions are always to care for the patient, right? So it would help the patient understand that, but also the other part with the communication component. I remember even with the masking stuff, it was very confusing. So we have to be honest about how we speak about this. Hey, we learn new information. Let them know that this is a continuous thing that's moving, and science eventually also finds different things. And it doesn't mean that we were wrong back then. It means that we knew that information then and we were working what we had, being humble about it, right? Also, I know you mentioned about we don't know everything. And we know what we know, and we can recommend upon the information about what we're telling you that, could be best for us, but that things can change because this virus is changing. So, but then that translates to everything else, right? We have this information to treat diabetes this way. Maybe later on, we're working on different things to help this other treat it this other way. But for now, this is what we have. So, being honest, being clear about the messaging, being humble, and then collaborating with others, because maybe our community partners can say it differently. Maybe our promotoras can also talk to people in a way we can listen, all of these different components. And I think the other part is the diversity component, the equity component. We're coming under attack for like having folks of color coming into working as doctors or nurses. And that really does help build trustworthiness as well with our communities. Because we see someone who looks like us and maybe came from the background like us. And that is something that right now I'm really concerned about, to see the lack of perhaps even more public health people coming into the arena, more physicians, more nurses that come from diverse backgrounds is what I'm concerned about too right now, that we had been doing progress in.
So to speak to what you were mentioning about all the lessons learned and how we collaborate and how we had regular communication and we had regular meetings, right, where we could come together to share, I have to agree with Isabel, that has slipped. We said we wouldn't let it slip, but yet we did, because there was so many challenges in front of us financially that the last year has been one of those interesting years. And Isabel and her team, I know, has been going back and forth with even going to Washington, D.C. to talk to legislators, to inform and educate. And we've been doing that on the public health side. But thank you for bringing that up. We need to find avenues, find places, find time, even if we say we don't have it, to come together. And this is such a interesting moment because our whole health system and our scientific groups and our researchers are all at risk over the next year, if not 2 years, with HR1 and all its impacts. So we're trying to create those avenues. I know Coalition has been having these regular meetings, coffee connections. I know from the agency side, we're trying to reestablish a regular setup so that I can meet with medical leaders on a regular basis to talk through the challenges. I know other organizations are doing that as well. We're working on it, but we still have a long way to go.
Doctor.
I wanted to touch on the uncertainty, but also, the idea of science, and we've been talking about educating patients and the role of healthcare workers, but all of us, including the schools, universities, community-based organization, educating people about science, right? And how does it work? And that, we don't have all the answers. COVID, was the perfect example where we were learning as we went, and people wanted us to have all the answers, and they weren't there. It took time to learn things, and understanding that that's a process and educating people about how we learn things and what science is and what's role. I think we've assumed people have seen the benefits of science and, everyone buys in. And it's clear that's not true, and that's something we all as citizens need to work on.
Here.
Make sure that you're here in the community. Don't assume that you're trying to answer the question that you have in your brain. Ask. And it will tell you, because all of us, we talked about different ways of why to expand. Right now that we were talking about like different schedules. Is it because of autism? Is aluminum? If it's too much, is that there's reasons, and understanding the real reason will actually help you guide the conversation.
Thank you. And I guess I got the red screen again. Do we have any other questions? We may have time for, we have a question.
Thank you. Good morning. I actually worked at Latino Health Access too, and I worked with promotoras, and I still think it's one of the best interventions for changing health behavior. This question is for the providers. Fortunately, one left, but I did want to ask, when it comes to parents denying vaccinations, do you still push after that first rejection? And if so, what have you found to be the best strategies or methods to be most effective to change their mind? Thank you.
We were just talking about, asking questions, right? What is it? What is your concerns, right? Is it all vaccines? Trying to understand and see whether there's room for negotiation. And, if it isn't today, leaving open the conversation, say, let's talk more about this, right? What can we agree to today? I think healthcare is a negotiation, and you have to figure out, how can I move forward with you, or what can I move forward with you on?
Thank you. I saw another hand back there.
Hi, my name's Alicia. I'm a public health student and research intern at UCI. I noticed you talked a lot about bridging the gaps for underserved communities, and you also talked about how digital our world is. And so I'm just curious, with that in mind, how feasible the option of leveraging social media as a means to bridging said gaps for the underserved groups is.
I think we still need to look in social media. And I know that when we do go into social media, we do need to work with our partners who understand our community the best. And it really should be from someone from the community, right? That we already know that people are going to trust. So I know at the state level, they're working on strategizing how they're going to provide the unified message from the Healthcare Alliance. So all the different states that came together on the West Coast on how to message this. So there'll be social media from that aspect. But I know locally it matters, right? That it's coming from our own county, our own communities. So I'm sure there's going to be a lot of work on the ground, whether it's from UCI and our academic partners or even our community-based organizations and our communities in general.
Yeah, I would say social media I mean, we talked about human connections, and obviously that's still the very important part. But to social media comes the question, right? Like how easily it spreads, how much money there is in social media, and the time that it takes to create stuff. Because sometimes I create stuff and I'm like, wow, that took me like 2, 3 days because obviously I work full time. If that was my full time job, that would be a different story. But I think a lot of us don't, like as health professionals, we don't have that time. So it's like the investment of that is also huge. And there's a whole marketing stuff that has to go in there. There's just a whole, like you would actually have to study how it is that people are taking social media, what's shareable, what people actually want to talk to their families about. Because I get a lot of stuff on WhatsApp from my family. And it's from literally websites, sometimes Facebook, sometimes Instagram, TikTok, right? And it's like we do have to explore what it is that people are looking at, how it is that the algorithm is working. Because the thing is, this is a for-profit world, and that's kind of what's driving a lot of these things and clicks and stuff. So we have to do a lot of studying, and I think as individuals, we may not have the time, but we might have to collaborate with other folks to kind of someone researches up like how it is that people are engaging with things, how are they looking at things, how long do people look at things? All these are questions that I think we still need to study and answer and then actually put to action, which is very time consuming. And I think that's the thing that is like holding a lot of not only organizations back, but even individuals who are doing this. And it must be really tiring to do all the time when you have a full-time job.
Isabel, I saw Carlos has had his hand up a few different times. I was hoping could we get to one more question? Do we have time for that?
Absolutely.
Okay.
You guys touched a little bit already with social media. I'm fourth year human biology student at UCI. And the question I wanted to ask, a lot of my college peers get their health information from TikTok. And usually like TikTok posts are really about fear mongering, but it also favors like very emotional content. And people really tend to believe that type of content, even though the information is wrong. So how does like evidence-based information, especially concerning vaccines, can compete in that environment, especially when you're talking to like a patient or things like that?
And we just have to recognize that maybe we don't have all the answers, and we need to be careful about where we're putting our resources. If we've done our job right in the community, right, with partnering and getting everybody to feel comfortable with us, the influencers may actually come from our own community that we've done such a great job connecting with. So again, we can, on the government side, we're not allowed to use TikTok, so that's already a big no. So we're utilizing all the other social media, and this is also, we're trying to put a face to our public health clinicians so that people know us as people rather than as these scientists behind the scenes. And I think, again, we have to put that humanism back into all the experts and make sure that people know we're part of your community. We want you also to be healthy, but it requires a lot more engagement and a lot more thought behind it.
I think I would also want to go off on that because you mentioned the scientific part, like educating people on how science is done. I think that's a component that we're also lacking here because if we understand how science, the progression of science, how we come about with these recommendations, et cetera, people are even inoculated, like there's a firewall of like against, the influencers. Because most of the time that's the thing, right? Emotion is always going to get the clicks. But people, when they understand how science is working, when we are doing that education on top of everything else, when they look at it, they're like, wait, that doesn't make sense. This seems like an outlier. Like people would understand like, oh, that 1 out of a million people may have this effect. And also being honest about some of these side effects, because sometimes, yeah, you get the vaccine and like you mentioned, I'm probably going to be out for a day. And when we explain to the public what actually can, be possible if you get the vaccine or like the actual numbers or how science is conducted, people are more likely to look at that and be like, this sounds really weird. I mean, I look at that, I'm like, that sounds weird. They want to capture me with emotion, and kind of teaching people social media literacy skills as well, social media, like how to prevent that. There's also trainings on that I've seen happening. We actually are going to have one this month for the Public Health Ambassador Program on social media safety and spotting misinformation and all of that. So we have to not only there's a whole thing that we have to do, right? The science education, the community building, the community promotoras and the people they trust in that sense, but also how to be safe on social media. So all of these are all components that we can do through an educational lens, and that would be one of the ways to inoculate people even when they're looking at stuff.
Thank you for that. I wanted to share that I'm a big consumer, right, of social media, and get hooked or get I'll respond to the emotional type posts. And maybe it's a matter of, what vulnerable position you're at the time that you're looking at stuff. But I always default to looking at the comments, right? I want to make sure, is this true? This doesn't sound right. I mean, I got captured by the emotional response, but eventually I find some evidence in the comments that says, oh yeah, I knew that sounded funny. And that has no scientific background, right? But that's just my feedback on how I respond to some of those posts, because there's definitely an algorithm that is being developed based on what you click on, what you like, and what you see. Dr. Bullock?
The fact that, I guess I'm always sort of a silver lining person. I feel like the fact that some of the skepticism against medical experts and medical decision making kind of came from this thing that I think Jackie mentioned about you're just going to make more money the more you the more service you provide. This is a profit motive for you. I feel like that exact same instinct it creates a possibility for people to see that in the social media environment, there are these incentives and profit motives and other things that kind of accelerate content. And could that be sort of a place that we help engage people in considering things, using strategies like looking at the comments and other ways of validating sources? So that's a great question. Thank you.
Thank you. Okay, so it looks like we're at the end, but I want to make sure I didn't miss anybody's hand. Okay. Well, again, so as we near the end of today's Coffee Connections event, I just want to take a moment to reflect on the conversation we've had. It's clear that our perspectives may differ, but we have a shared commitment to healthy communities and informed decision making is what's making us come here together. I know that there's a lot of takeaways that we've learned throughout the conversation today. Thank you to Sonia. She summarized a few of them. But before I do that, I really want to extend my heartfelt gratitude to our panelists, the time that you spent here today. So if you could please join me for a round of applause. I think we dove into this conversation a little bit deeper than I thought that we would. So thank you so much. And again, thank you for the team that planned the event. There's a lot of prep work that goes into putting these events together, but more importantly, how to make sure that the conversation is meaningful, that you all walk away with something that it's validating and it's relevant to the work that you're doing. So thank you for that. So I am going to highlight some of the takeaways. So again, we know, and these are direct quotes from your conversation today, right? So we know how to save a life, but we don't know how to communicate sensible things, right? So we need to improve on that, especially on the provider side. We need to repair relationships so communities can know we care and so they can trust in our perspectives. We need to bridge care gaps with culturally and linguistically appropriate care. And we acknowledge that we're starting to live in a more digital world than a human connection world. So we need to re-engage in human connections. And then how do we leverage community partners like schools to ensure our communities get the information they need, especially when not everyone is seeking primary care? And then the status quo bias, when we wish to not, oh, you killed my mic. Oh, when you wish to not take something new or make changes, our ability to change or take on something new diminishes when the systems are more complex, and our intentions can be narrowed when we face outside pressures or other factors. So hesitancy isn't always no. but a not now, and not nows feel safe. And if there's a position for us to move forward in. Our CHWs, or community health workers, and promotoras, promotores, are some of the most effective people we have to get the message out. And our goal should not be to build trust, but to cultivate trustworthiness. And that was it. Thank you all so much. If I missed any other key takeaway, please chime in. And before, again, you depart, please take a moment to complete the evaluation using the QR code on your table. The first 5 individuals to complete the evaluations will receive a gift card. Your feedback is invaluable and will help us shape future events like this one. Our next Coffee Connection is scheduled for February 27th in 2026. And with that, thank you all so much for your participation and attendance with gratitude. Thank you so much.